Last fall, the Cameron Foundation invited a team of Virginia Commonwealth University researchers to explore a stalled community response to the loss of the region's only men's shelter. Today, we will walk you through our study and what we learned. The Crater District is a diverse group of 7 localities that are largely in some state of decline. There are 3 small cities, 3 suburbs, and 2 rural areas. Eviction rates are high, with Petersburg ranking second in the nation for evictions in medium-sized cities. Created in 1993 with 122 million in assets, the Cameron Foundation is a large funder for the Crater District and the only one dedicated to serving the Crater region. When the region's only men's shelter closed in 2017, it was a catalyzing event for the Crater District to change. For more than a year, volunteers, churches, nonprofits, and government agencies met to find a solution. The foundation continued to support service organizations and the community initiative, eventually asking, what is the optimal role for this foundation? When we looked at the literature, we learned that government is the primary funder for homelessness services, and that funding is driven by data. In the Crater region and elsewhere, homelessness is severely undercounted. Most who are homeless do not need permanent help, and the least expensive solution is prevention. We also learned context is critical. Suburbs, cities, and rural areas are likely to need different solutions. Because homelessness is especially complex, foundations support tends to be highly strategic and a minor portion of the overall homelessness services funding. Serene?
Yes, thank you, Nancy. The study area for this study is located in Central Virginia, comprising of 7 localities. Among them, most of the homeless service providers are concentrated in the city of Petersburg, which is also the home of the Cameron Foundation, and the surrounding counties of Chesterfield, Prince George, Dinwiddie, and the city of Hopewell, as shown in the map. We obtained the Homelessness Service Providers database from Homeward, which is the planning and coordinating organization for homeless services in the Greater Richmond region. The data included information about homelessness services provided through their partnering agencies in the region in 2017. The data did not include information on the services provided by some religious institutions that did not keep track of what they do. Additionally, since most of the service providers prioritized their services to women and children, there could be a bias towards this demographic and a slightly lower representation of adult homeless men than the ground reality. To control for the bias, we compared the data with the annual point-in-time count, but the estimates for the region were unreliably low. Our study area had about 1,044 homeless people that received some form of homelessness services in 2017, of which about 56% were female and 89% were African American. 35% reported to have mental health issues and 68% reported some form of substance abuse disorder. About 44% were under the age of 18. We also evaluated the prior residency status of the service recipients, the types of services they got, and where they went after exiting from various homelessness programs. It was interesting to see that 27% of our sample were renting on their own prior to enrolling for homeless services, and about 18% living in a motel or with a friend or a relative. Considering the increasing rates of eviction due to the COVID-19 pandemic, we anticipate the current ratios will be much higher. This data reflects the proportions in 2017. As we see from the table, about 44% homeless individuals seeking help only received basic case management support. Of the remaining service seekers, 27% received rapid rehousing and 22% received prevention services such as rental assistance or eviction prevention. Half of all those who were identified as being chronically homeless received rapid rehousing services, and about 20% of them were housed in emergency shelters. Only about 16% chronic homeless were enrolled in permanent supportive housing programs. A majority of service recipients were provided with temporary options such as rapid rehousing or emergency shelters. Although rapid rehousing shows promises among recent homeless needing temporary support to get back to normalcy, our data showed a high percentage of chronic homeless and disabled or people with substance abuse disorder enrolled in the program, which was an indication of a mismatch to us. We also looked into the uses of homelessness services by prior residential arrangement of the homeless individuals. Most people who were renting on their own or owned their house and got presumably evicted or foreclosed recently received basic case management services and some form of rental or eviction assistance. Many of those whose prior arrangement was in an emergency shelter or those living in the streets got enrolled into the rapid rehousing program, which is also an indication of the mismatch. After exiting from the program, about 40% went back to renting their own apartments, and only about a third of them received some form of rental subsidy. About 13% went back to being homeless again, living with their friends or family. And 33% of the homeless population exiting the program did not provide any exit destination. So there is some big gaps in the data set we used. We also conducted a basic cost benefit analysis of the services provided in the region. The cost of providing homeless services were compared with the cost of doing nothing. Based on the current literature and under the assumption that doing nothing will increase burden on the criminal justice system and the medical service providers, we estimated the cost considering the percentage of existing homeless people that are likely to end up in detention facilities or in the hospital, and their average length of stay, and the reported unit cost per day. The unit costs were not available from within the region, were estimated based on information obtained from localities comparable to the city of Petersburg and surrounding areas. Excuse me. The total cost of providing homeless services at the current level is estimated to about 1.5 million. Similarly, based on the unit cost of hospital-based services and the criminal justice system obtained from the literature and the cost reported by Virginia Compensation Board, we estimated the total cost of not providing the current level of homeless services to be around 2.04 million, which suggests that provision of homelessness prevention and housing-related services brings $1.33 return on every dollar invested. The estimates provided here are conservative and do not represent other costs, such as loss of business, reduced property value, degradation in quality of life, reduced educational performance of homeless children and their future career potential, etc. And here is a summary of the findings as discussed above. And with that, I would invite Ava to present findings from the interviews and gap analysis.
Thanks, Serene. When doing our research, we thought it was imperative that we speak with service providers and stakeholders in the area. And part of our efforts were focused on conducting interviews to gather data on the perceptions and strengths and weaknesses across the region. So we did a thematic analysis of what was said to prepare these findings. We held interviews with administrators of programs, government officials, nonprofit service providers, and churches. And 5 things that we heard were working well include specific regional, will you pop back for, yeah, thank you, perfect. A specific regional collaborative created by representatives of local organizations, which was recognized as a leader and valuable resource in the sharing of information. That would be CASH. The cold weather shelter in an adjacent county that serves as a key resource for those who could access it. the coordination of services and leadership of the Commonwealth Catholic Charities, the shared HMIS database that they were all using, and last but not least, the outreach done by case managers and religious groups. Some areas noted for improvement included the inconsistent data capture across agencies, the need for an expanded set of services, the limited capacity of agencies, government hesitancy to meet the needs of residents without housing, and the lack of low barrier or more flexible models of shelters. So we concluded our interviews by asking people what they would like to see in the region in the coming years. We heard a designated youth shelter, more affordable housing options, transportation, wraparound services for people who are in housing, as well as eviction diversion programs.
Looking at all three regions where foundations had taken a leadership role, we see that there are similarities. Each community had a catalyzing event that mobilized people. Relationship is considered of high significance, both with those who are homeless and the homeless services providers. All regions required a culture shift among organizations and a service shift to a more integrated response. And measures of success will be community-based rather than some sort of an artificial benchmark. Considering the best role for the foundation, when neither the problem nor solution are clear, adaptive leadership in the form of shared learning to mobilize stakeholders and focus attention provides a useful framework for change. We thank you for your time. And we in the Cameron Foundation invite those of you who are interested to read the full report. Let us know.